Now on India Development Debate, let's turn our attention to the latest on the coronavirus and where things stand with fears of the outbreak gathering momentum in recent times. But if you consider the way the stock markets around the world, how they've been playing out, they have resumed rising, they're edging towards record highs, and the way the dollar has reached a 4-month high, you may be led to believe that they're going by these reports, especially the one that is coming in from China's top medical advisor, who said that the epidemic may actually be plateauing out in the next few weeks. Of course, as we reported, China's factories have been struggling to reopen after an extended Lunar New Year break, and analysts have been warning that investors, they may be underestimating the economic damage that this outbreak could cause. But still, the mood has remained strong after the surge that we saw on Wall Street overnight. So yes, even as the death toll in mainland China has climbed past 1,000 on Tuesday, the number of new confirmed cases have fallen. And with all of this playing out, we're wondering if the coronavirus outbreak is actually likely to peak out. Let's first go across to my colleague Mobina Kapasi. She's here to tell us just that, to get us a perspective on how this is panning out, how the numbers are looking, and indeed the economic impact as well. Mobina.
Well, finally, a glimmer of hope, if you could call it that, since the outbreak of the deadly coronavirus back on New Year's Eve. Here's what the stack-up is looking like. Yes, the number of confirmed cases are definitely, of course, at record high levels, but the fact is that it's slowly plateauing. So there you have the daily net change in confirmed cases. And as you can see, the bar graphs actually ebbing off a tad bit, towards the last couple of days. That's the reason why the daily percentage change as well, as you can see, has really been ebbing off gradually but very steadily, and I think this is of course a glimmer of hope. I wouldn't say the same of course for the number of deaths, unfortunately, which is of course continuing to increase. The number of confirmed deaths is extremely high, but again here as well the hope is that the daily net change in deaths will reduce. Look at the poll up until now. Of course, China is the epicenter, but in terms of the number of countries that have been affected outside of China, the death toll over there as well is in triple digits. 319 cases confirmed in 24 countries outside of China. And obviously, it's going to have huge ramifications. The WHO has already warned that it is a very grave threat for the rest of the world. And, for the corporate world as well, for the economic world, for the political world as well. We already have commentary coming in from Donald Trump as he expects the virus to go away in April. One truly hopes that he is right this time. Asian markets, meantime, today, on the hope of the virus ebbing off a tad bit, has already seen a rally. Indian markets as well, our very own Nifty saw a close to 100-point rally. But of course, those safe haven buying has kicked in. So gold and dollar, that's why, has hit a 4-month high versus the euro. Gold and dollar, usually your safe haven assets. On the flip side, commodity prices have declined. Oil prices is down on the back of weak Chinese demand. But again, we did have certain Chinese commodities like iron ore, steel that rallied again on the back of the fact that the hope is that the virus may just plateau out. Now, Ray Dalio of Bridgewater Associates thinks that the market has really reacted in a very over-exaggerated manner when it comes to the coronavirus, and hence maybe he's making a case that maybe from here on you will see an uptick. Foxconn, meantime, trying to resume partial production at its main iPhone making site in China. Corporates, remember, still have not full-fledgedly gone back to normalcy for obvious reasons. Meantime, back home, we are seeing an Indian national in the United Arab Emirates that has been tested positive. But in relatively better news, the first Indian who was tested positive in Kerala, he's been retested and looks like the latest test is indicating a negative. So let's see how that pans out. But of course, implications on global growth, and I think this picture says it all. The coronavirus impact is said to be obviously the highest in China. We're expecting a 1.5% hit to China's first quarter. That's the March quarter GDP. Japan and the rest of Asian markets will be impacted by about 0.4%, whereas areas as far as the Eurozone and United States as well may see an impact of about 0.1% to their March quarter GDP number.
Mobina, thanks very much. That indeed gives us some perspective of where we actually stand when it comes to the number of those deaths that have been reported, and also the infections, and indeed how the economic impact is playing out across the world. You're seeing the markets show some bit of recovery from the likely impact of coronavirus, and those fears were really playing out. But now the mood seems to be turning a little bit. But how is the medical fraternity looking at these developments about this question or whether the coronavirus spread is actually peaking out? Dr. Sanjeev Bagai, the Chairman and Managing Director of Nephron Healthcare, is joining us on India Development Debate to chat about this. Dr. Bagai, it's great to have you with us tonight on the show. While the death toll in China from the coronavirus outbreak has exceeded 1,000, the number of confirmed cases has reached now nearly 43,000. There are a few indicative graphs that my colleague was showing as well. We've been sharing it with our viewers that the outbreak could be peaking out. I want to understand from you as a medical practitioner, what are the kind of indicators you would go with that would suggest an outbreak actually getting under control? Basically, we'd like to know from you if you see these signs that you would go with to be convinced that this virus could be peaking out.
Hi, good evening. I think this is an extremely important and a detailed question. Now, this is just to set the preamble correct for this is that this is a very new virus. This is a virus which has never been exposed or entered into a human being as a human body. So the normal human being does not have a natural immunity or antibodies towards this virus. This virus is peculiar in the sense that it has a long incubation period from 9 to 14 days. It can remain on surfaces if a person coughs or sneezes for 5 to 6 days. And it has a propensity towards human-to-human transfer. So keeping that in mind, I will still not keep my guard down. There is some amount of skepticism with regards to the exact number of cases in terms of mortality and morbidity, yes, which are coming out from within China. But the point to note is that this virus could actually take 3 courses. It's a new virus, so we'll have to see how time pans out for this virus. It could be just a one-off epidemic in the local area. It could turn out to be a pandemic, which means it has crossed the global boundaries of various countries and having a higher number of incidents than acceptable. And third is it could be following a seasonal pattern, like a seasonal flu. So keeping these 3 things in mind, that again time will tell. But keeping guard up, I think it's still early days for this. A lot to do with the virus mutation and virility will also be on the temperature changes in that area. So the winter is panning off and now the summer is coming on. Maybe the incidence will decrease. But I think we will see a huge change in global trends. I think we will see a huge change in global trends with regards to eating habits, eating live animal stock, uncooked animal stock, or dealing with animal stock. We will see a huge change towards screening perpetually of international travelers.
Yes.
And I think we will also see a huge change in human beings taking our own body a little bit more seriously in terms of personal hygiene, hand washing, and keeping away from infected people.
We hope that happens, because as a normal practice, perhaps the creation of these viruses and the havoc that they cause would be stemmed if we follow certain patterns of hygiene across the world. But be that as it may, you did mention that the virus and its spread could get contained with the onset of summer. Now, we've heard the President of the United States make an allusion to this as well. Do you think that that could actually work, that this virus will have to wait until, say, perhaps the month of April, which is what the President of the United States has said? That's when they're expecting the impact to taper off.
Yeah, I think that's again an important point, because once this virus enters into the community, so there are 2 sources. One could be a single source point of contact of spread, which is not the case in this, because very clearly it has gone into the community. So when a virus or an infection of this virulence enters into the community, then it's a multifocal and a continuous spread. So it's a person-to-person transfer, and each single contact could infect many others, up to 2 to 3 in a given period of episode. And this spread from 1 to 3 and 3 again to another 9 should it's into the community as a binary fission. So I think a lot will do with the temperature changes across the world. Viruses are known to behave in a peculiar manner depending upon the environmental temperatures, the virulence changes. They can have various shifts and drifts in terms of the virulence or the invasiveness of the virus. So I still feel we are about a month or two away from calling it at bay. But I think we still need to keep our guard well up.
And it's important that you keep highlighting that point, Doctor. And even as these worries have been growing about the extent of damage of the kind of economic disruption that we can expect because of this virus, and it's going to damage the world's second largest economy, as it were. So you're talking about a long-term impact as well. But you're seeing certain countries take certain measures, like Singapore, which has ensured that there are enough masks that are available to people within the country. They've ensured that there are no the large events where you're going to see large turnout. Now, those have been stopped as well. So you're looking at countries being able to deal with this virus more effectively than others. How are you seeing this working out throughout the globe? Because I'm sure you're looking at the kind of reports that we are as well. Is there a better way of being able to control the spread that some countries have taken up? That's something that India could use as well?
I think when you have a very small pocket of population in which a city is a country and a country is a city like Singapore, it's very easy to implement measures. But when you're looking at large spread of land like India or indeed Russia or USA or Canada, it's sometimes very difficult to monitor the disease as far as spread is concerned. But really the take-home message, apart from personal hygiene, hand washing, wearing a mask, keeping away from people who have a cough or a cold or sneezing, is really identifying at a very early stage people who potentially have come in contact or have had a travel history to those given areas and following a strict discipline of quarantine. So I think when you know the incubation period is up to 2 weeks, to quarantine the particular person as an index case for up to 2 weeks, checking his personal contacts, where all he has met, who he has met, where the person has gone. So I think a continuous surveillance is still mandatory. I think the Indian government has done a fantastic job. We've put on all the thermal scanners in most of the airports. We are checking the travel history. But again, the thermal scanners only have that much role as a limited manner, because a person may not manifest with fever and still be in the incubation period. But having said that, I still feel that we need to have a very high level of surveillance. And in case you identify a potential case, I think strict quarantine, strict hygiene, septic barrier nursing is extremely important.
So these are the known facts, Doctor. Is there any additional knowledge that we've gathered about the coronavirus since the first time that we heard about it and all these precautions started to come out? How are you advising patients now, especially if they are traveling to attend, say, a World Mobile Congress in Barcelona? Incidentally, we've heard only earlier this evening that Intel and Vivo, they're not participating because of the outbreak. So are you even suggesting to most people who can avoid travel to avoid completely at this stage where we are still waiting for more positive cues about this outbreak peaking out?
Yeah, I think as far as this virus and its prevention is concerned, for the next, I would say, 4 to 8 weeks, still traveling into mainland China or in districts who have reported a high incidence of cases is a definite no. But otherwise, traveling internationally and globally, I don't think that's a worry. But here again, in very large crowded areas where potentially people could be carrying any infection, keeping self-protection is a must. I don't think Europe is as much as at risk as China and Southeast Asia, where we've seen more number of cases. Again, for travel advisory point of view, I'm still repeating it, that we will see a huge change in the perception of international travel guidelines, screening of passengers. The queues are going to get a little longer. The travelers must be more patient, because each person will be screened not only from a physical point of view, but from a medical point of view.
Doctor, it's a pleasure having you on the show, getting your perspective on where things stand on the coronavirus and the kind of precautions that one must take as far as travel is concerned, and indeed general precautions of hygiene that we all need to follow to ensure that, these kind of outbreaks don't wreak the kind of havoc that they do by the kind of spread. So let's see if that can happen. But for the moment, it's the latest that we are getting you on the coronavirus, how the figures stack up, as well as the economic impact. We take a small breather now on this edition of India Development Debate. On the other side, we still talk about the markets. Remember, India is a slowing economy. Now, how do you pick alpha stocks within this kind of scenario? We've got a word coming in from Neem Kumar. We're having a chat, and that's something that's on the flip side of a small commercial break. Also, we'll talk about the auto sector. Now, the second-hand car market is gathering momentum, and we've got some figures. We've got an interesting conversation coming up with the man behind Cars Deco. All of that on India Development Debate tonight. Stay with us.